Welcome to the Truth and Fertility podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also maybe even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created and how it should be working, and the best medicine in order to make it work if it's not, then you are in the right place. Welcome back, everyone, to the Truth and Fertility podcast. So I just got back from Florida, actually, which was beautiful and wonderful. And I was there because I went to a speaker training for an organization called FACTS About Fertility. And I learned a lot while I was there. I was being trained to give certain talks and presentations to medical audiences. And for those of you that are just joining on this podcast, so I do currently work at an OBGYN clinic where I am I'm an NFP instructor. More specifically, I'm a Creighton instructor. So that is it's a method of natural family planning. And so I teach women and I teach couples how to chart their cycles. And for a long, long time, I was just doing it really in the space of teaching engaged couples because, of course, it's called natural family planning, right? It is a way to plan your family in accordance with, maintaining the dignity of the woman, the integrity of their marriage, not introducing any contraceptives into their marriage, and also it's a ton healthier for the woman's body anyway. And so I was in that space for a really long time. And then I received the opportunity to work for this OBGYN clinic. And that has been so incredible. And I've just learned so much about how if we are just looking at charting the female menstrual cycle for the sake of family planning, as important and beautiful as that is, we are really limiting ourselves because there is so much more that can be done with teaching couples how to chart their cycles. The fact that by the fact that she is charting different biomarkers or signs in her body that her body is showing her to determine when she's fertile, what this means is that she can literally chart her hormone movements, because what makes those biomarkers, what makes those signs that she's seeing and what makes them change? Hormones. So if she's charting those biomarkers or those signs, the most typical one being cervical mucus. I have a whole lot of information and other podcast episodes on that. I'll put them in the show notes below if you're more interested in that. But that is like one of the main ones, right? But there's other things too that a woman can be observing throughout her cycle to show her where she's at in her cycle. And that is exactly why it can be used for family planning, because women are not always fertile, right? So she's looking for that fertile window, that short amount of time during her cycle that she actually could get pregnant. And if she is trying to avoid pregnancy, then she would avoid intercourse during that time. But if she's trying to achieve pregnancy, she could focus intercourse with her husband during that time. So it can be used for both. And it's the only family planning method that you don't have to change anything except one behavior to change your intention with it. And that one behavior obviously is when you decide to have sex. So anywho, but the fact that she is checking her biomarkers, she is literally taking in data on a chart of her hormone movements. Let's just think about that for a second, because that can do, like I mentioned, that can do so much more than family planning. that can show us hormonal imbalances. That can show us possible disorders or diseases that she has that can be treated. Like, there is just a whole new world that opens up with this when you are starting to introduce this into a medical scene. So, with all of that being said, Facts About Fertility is an organization that was founded by just family medicine doctors who knew about the impact of the woman charting her cycle using these fertility awareness-based methods, NFP, using this for the sake of medicine and proper diagnosis, proper treatment. And so this organization was founded by these doctors that wanted to teach other doctors about this, because so many of us, myself included, where we go to our regular doctor and we say, I don't want the pill. Is there something else you can do to help me with my irregular periods? And they don't have any other tools up their sleeve. And it's not by fault of them. It's the fact that in medical school, doctors are not taught even like basic reproductive anatomy and hormones. And I've even heard of there being OBGYNs that had no idea what the purpose of cervical mucus is for. And like that, if you've listened to any of my podcasts, especially, I have a whole episode on cervical mucus, so listen to that. I'll put that in the show notes, like I said. But that is vital for fertility. It's vital for a woman to get pregnant, for her to be producing a good quality amount of cervical mucus. And so the thing that I heard at this conference, or the speaker training that I was at, where I was one of the only non-medical people there. So me, as like a fertility awareness-based method teacher or instructor, or charting instructor, whatever you want to call me, I was one of those there. I was mostly surrounded by a lot of other doctors, a lot of med students, a lot of nurse practitioners, a lot of medical people. And the thing that I continued to hear over and over and over again was, why have I never learned this? And it blows my mind, because you guys, I very freely say that I am not medically trained. I have 3 kids, 5 and under. I have no plans to go to medical school anytime soon. Maybe in an alternate universe I would, because I think that actually would be really cool. But that's not the path that the Lord let me down, and that's totally fine and good. And so but to me, being somebody who's been teaching women and couples about their fertility, or even just the mere how to chart the signs of their fertility, it really blew my mind that people that have paid a whole lot more to be a lot more smart than I am in this field don't know these basic things. And it really, that just really impacted me to know that this is not something that's being regularly taught. And that truly is an injustice, because there are a lot of women out there, more and more women, that are struggling with infertility, or they have those irregular, or maybe even it's painful periods, right? They're having some sort of quality of, like, their quality of life is not where they deserve for it to be. And doctors don't have very many tools other than the pill to heal those things. And so, yeah, I mean, I kept hearing, there was this one med student that was with me, and she was saying that in her like reproductive anatomy course, or OBGYN, not rotation, but just whenever she was learning that kind of stuff, there was like one slide on a PowerPoint that talked about natural family planning, and she said that it was mostly about who can't use it, which is such a lie. So, because everybody can use it, unless you're past menopause, then there's no reason to use it. But anyways, it's not properly taught. And so that was a huge reason why I went to the speaker training, is because as I'm now working more in a medical setting, where I'm working in an OBGYN clinic, and I'm seeing women a lot of times that are struggling with infertility or some sort of fertility issue, And I am just becoming more and more passionate about making sure that other doctors, other med students know this information. Whether they're becoming an OBGYN or not, it is still, this is, you guys, it is basic reproductive anatomy and hormones. Again, I have a lot of podcast episodes just going through that for you, so that you can be more empowered and more knowledgeable about your fertility, so that when you do go see the doctor, you are empowered with that information and can really advocate for yourself and the decisions that you want to make with your health. And so there were, I realize I have not yet really explained what this conference was. So I was there because Facts About Fertility, the organization that put it on, their main goal is to teach doctors and med students, right, about charting the female cycle for the sake of medicine. And they hire on and train medical people, but also non-medical people like myself, to give presentations to medical audiences about this and to teach medical audiences about this, whether it's, again, actual doctors or med students. And they actually say med students are a little more receptive to this information, because it is crazy how hostile people can get about this information too. That also just blows my mind. I won't go into that too much, but it really does just blow my mind how non-receptive people can be to this. So Facts About Fertility, actually, just one quick little plug for them. They have a medical school elective. It's a virtual online elective for med students that want to learn more about this. So if you are interested in that, you can go to Facts About Fertility. I believe it's .org. And I will also put that link in the show notes below so you can check out their elective, because I highly, highly recommend, if you are anywhere in the medical space, that you become more familiar with this, especially if you are even OBGYN for sure. But if you're going to be working with women at all, this is going to be really helpful information to know. And just the basics of reproductive anatomy, hormones, physiology, and then basics of how to chart. It's just going to be so helpful for you to have a very well-rounded idea of women's health and how to properly diagnose and treat. So anyways, with all that being said, I was in Florida to be trained as a speaker for them so that I could bring it back home and hopefully, start kind of making my way into other either OBGYN clinics or the hospital that is connected to my own OBGYN clinic, just to get this information out there because it's so important. But anyways, I wanted to really highlight 4 different things that I learned while I was at this training that completely blew my mind. A lot of the stuff I already knew, which I was grateful for because it showed me that I've had really good training, which I'm incredibly grateful for. But there were some things that I was like, holy cow, like, why? I was even saying, why have I never learned this? Like, this needs to be known everywhere. And so if you are in a place too where you have never been taught the truth about your fertility, you've never been taught the truth of your hormones, what your hormones do for you, for your fertility, how to properly balance and treat them. I just think that you deserve that information. You deserve to be more empowered by knowing that information. And so, there's kind of 4 different topics that, just among all of the presentations I was being trained to give, there were 4 different topics that kept coming up. And so I took note of some of the things about these 4 topics that I thought were definitely of note and that I wanted to share so that the general public could also know this information. So the first topic is infertility, right? So many women are now struggling with infertility. More and more women are struggling with infertility. And from what I heard in one of the talks that was in my training, is that when a couple is struggling with infertility, approximately 30% of the time, it's just the woman. There's something biologically going on with the woman that's causing that infertility. 30% of the time, it's just the man. There is some sort of biological issue with the man's fertility. But 40% of the time, it is both. There's something going on with both the male and the female fertility, which I thought was really interesting because especially in charting women's cycles, I work mostly with women, and I have become a lot more familiar with a lot of the reproductive issues that women face. So I didn't know that literally that does mean that 70% of the time it's also a man's issue, which I didn't know. And so I hope to become more familiar and educated on that. But a lot of the women and couples that have this infertility, when they're experiencing infertility, the doctor tells them that they are quote unquote infertile, meaning that is their diagnosis. Now, I want to be super clear that infertility is not a diagnosis in and of itself. It is actually a symptom. Infertility, the inability to get pregnant, or also the inability to stay pregnant, is not a diagnosis. It is a symptom of an underlying issue. And that's something that needs to be made very, very clear, because so many women have this quote unquote unexplained infertility where they do not know what is causing their struggle to get pregnant. And a lot of times, there was actually a woman, I will probably have her on the podcast at some point too, because she had such a powerful and moving story. There was a woman that was also there at the speaker training, and she had that unexplained infertility, and the doctor told her that the only way that she would ever be able to conceive is through IVF. And so that's what she did. And she's now here at this training thinking to herself, what if there was something else that I could have done? Because she had never been told about natural family planning, charting her cycle. Like, she didn't even know what that was until like a year ago, less than a year ago, actually. And so now she's here going, there probably was another route, and I didn't know it. My doctor didn't know it, but there could have been a way to actually go about healing her body, healing whatever was causing the infertility, to then be able to conceive naturally, which I think is everybody's goal, right? Like, I don't think IVF is, for the most part, is anybody's like, this is the only way that I want to have children. Like, I feel like most people like the old-fashioned way of having children. And so she just had a very powerful story. It was just like, I wish I would have been given this other option. Whether that would have resulted in children or not, it still would have been more in line with at least treating her the actual underlying diagnosis and disorder or disease, rather than trying to bypass it or go around it. And so there was actually some data that was on one of the slides that we were teaching how to present, where it was talking about women and couples that were going through NAPRO technology. Again, I have a whole other episode on that, and I'll link that below. But NAPRO technology, just very, very short explanation. It's short for natural procreative technology, and it's just a new-ish women's health science that really just focuses on treating the underlying issue rather than giving the woman the pill or sending her to IVF, right? We want to actually treat what is causing the symptom of infertility and then treat it at the root, so that hopefully she can have children. Or if she's not even wanting to have children, or she's single or whatever it is, right, to at least get her healthy, right? We want to have you have a healthy reproductive system, as with any other system in your body. That's why you go to a doctor, to get healthy. So OBGYNs, doctors of the female reproductive system, need to be doing the same. So anyways, there was this data that was shown where women who went to go seek treatment from a doctor that was trained in naprotechnology, up to almost 50% of them came in to the evaluation with this quote unquote undiagnosed infertility. And after the evaluation of going through teaching them how to chart and then going through blood tests, maybe some ultrasound, just doing things to diagnose, less than 1% of those women left with unexplained infertility. So what that means is 50% of the women that had this unexplained infertility that came to this data research thing to get actually evaluated by a NAPRO doctor, 50% of them had this unexplained infertility. But after the evaluation from a NAPRO doctor and proper testing diagnosis, only less than 1% still had that unexplained infertility. That means 49% of those women left with an explanation as to why they were experiencing their infertility. And there were like actual numbers too, and I cannot remember the actual numbers of this specific data study, but I just remember that almost half of the women that were going into this evaluation had this unexplained infertility, and only 1%, less than 1% of them left still with this unexplained infertility. So that means the remaining 49% of them left at least with an answer. And when you are going through this infertility journey, I can imagine, I can't imagine the struggle and the anguish and the pain of that. But having this unexplained, like, not only are you having the struggle of infertility, but you're also having the struggle of not knowing what's causing it. That's also, I feel like, an injustice. And so I would hope that having some sort of explanation, and not just for the sake of peace of mind, like, oh, okay, now I know why, but not only that, knowledge is power. So when you know why something is happening, that gives you more power to be able to treat it, right? And that is our goal. That's our goal. So that was just mind-blowing to me, that after just one NAPRO technology evaluation, where we're actually looking right at the root cause of what could be causing your infertility, most of those women got an answer. And then I'm assuming also went along then to get treatment. So that really struck me, in that how many women are out there right now having this unexplained infertility. And not only is the infertility a struggle, and struggle isn't even the right word, that's not a strong enough word, but not only is that disheartening, a struggle, incredibly painful, but also having it be unexplained. So just with the fact that you can chart your cycle, work with a doctor that can read that chart, and then do specific testing, like on specific days of that chart, with specific, like knowing exactly what tests to run on specific days of your cycle based on what your chart is showing. That's so much more power than just saying, here's IVF, or just saying, here's the pill, right? There's so much more empowerment that comes with actually getting down to the nitty-gritty and seeing what is causing this, right? So that was the first thing, just like with infertility, that really blew my mind. And I feel like everybody needs to know that they can have an answer. Most likely you can have an answer as to why you are struggling with infertility, because again, it is not a diagnosis. Infertility is a symptom. Okay. Now let's move to miscarriage. That was the second theme that was really coming up a lot, and I learned a lot about it that, of course, I want to share with you. So the first piece of data I just want to share with you is that 15 to 20% of pregnancies between 5 and 12 weeks will end in miscarriage. That number is insane to me. 15 to 20% of pregnancies. That means that 1 in 5 pregnancies will end in miscarriage between weeks 5 and 12. First trimester. 15 to 20% between weeks 5 and 12 will end in miscarriage. And also, too, though, we know that pregnancy doesn't just start at 5 weeks. So how many miscarriages are also happening before 5 weeks? That's also probably, a lot of those happen at home. And so we don't necessarily have the proper data on that to say. But all of this is just to say that miscarriage is happening way too often. And the other crazy thing to me is that most doctors, and I know this one because I heard it at this training from a doctor who was giving this presentation, but I also know people, I feel like most of us know at least one person in our life that has had a miscarriage. And I actually know someone who was in this position where she continued to have miscarriage after miscarriage after miscarriage. And the doctor she was working with did not really do anything about it until like the second miscarriage. And then even then he was like, it's kind of normal to happen. Let's wait and see if it happens again. And then of course it happened again. She had a third miscarriage, and not until her third, the doctor was like, oh, okay, we should probably look into seeing what's going on here. That to me is absolutely just insane. That just is insane, because I feel like anybody who has had a miscarriage will tell you that there is a real loss with miscarriage. Like, that is a baby. That's a baby that was lost. And to have that hurt on your heart and just that pain of that loss, and to not even after just one, we should be looking into, why did that happen? What's going on? Because especially with these early first trimester pregnancies or miscarriages, a lot of times with the first trimester miscarriages, it's caused by some sort of hormone imbalance with the woman or with the mother. And that's not to say across the board that that's what's going on, but oftentimes in the first trimester with miscarriage, oftentimes it's a progesterone issue or it's some sort of hormone issue. And oftentimes that can be treated. So why is it that we are not looking into that after the first, like, or even when you have your first pregnancy? Let's get you a progesterone test to make sure that your progesterone levels are looking good. Because if they're not, that could be a life saved. If you could give a woman in her first trimester progesterone, bioidentical progesterone, that could save her pregnancy, which means that could save a life. So why are we waiting for women to have 2, 3, 4 miscarriages before we actually start looking into that? We should be doing that at pregnancy number 1, just to make sure, because so many women, it's actually crazy how many women I even see at my own clinic that have low progesterone. And progesterone is vital for keeping a pregnancy going. And actually the baby will also give off progesterone too. It's really amazing. Just that the whole thing that's going on there with the mom having progesterone, the baby having progesterone, and other hormones that are involved, right? It's really a beautiful orchestration of what's going on. So when there's any sort of imbalance, that can cause trauma to that pregnancy and to that baby, and could possibly end that pregnancy. So we want to be making sure that miscarriage is not just, we're not flippantly saying, oh, let's wait till you have another and then see if, and then it's a recurring issue and then we can start looking into it. Like, no. We need to be looking into it after the first. And the other thing with this is this was so interesting to me. So around week 8 or 9 of a pregnancy, so before the 8th week of pregnancy, the corpus luteum is what is producing progesterone for the most part. So the corpus luteum was it was the follicle around the egg. So if you have all of the eggs in your ovaries and one egg is released at ovulation of every cycle, well, before the egg is released, there's a follicle that grows around it. It's basically a cyst that grows around that egg, and it is the house of the egg. When ovulation happens, that follicle ruptures, and that's what allows the egg to leave the ovary. But that follicle doesn't just disappear. It has a job still. It turns into what's called the corpus luteum, which is literally just Latin for yellow body. I feel like we try to make ourselves just sound so smart by saying corpus luteum, but no, it just means yellow body. So it turns yellow and it starts to produce progesterone. And so if a woman gets pregnant, that corpus luteum is going to continue producing progesterone, because in order to sustain a pregnancy, you need progesterone. Now, around week 8, the corpus luteum starts to dissolve. It starts to dissolve. And as it's starting to dissolve, that's when the placenta starts to take over. And then it's the placenta's job at that point then to start producing progesterone. So there's kind of like a handing off of jobs here around week 8. Now, we've heard of a lot of women who have had a miscarriage around week 8. And it is because, again, this is not across the board, but this is just in a very generalized idea that it could also just be because of that passing the baton of the corpus luteum to the placenta of production of progesterone. There could be some progesterone deficiencies during that time of transition. And if progesterone gets dangerously low, that can be fatal for the baby and fatal for that pregnancy. So there was a doctor who was recognizing this pattern. He was recognizing how many women were experiencing miscarriages right around this time. And so he actually, in his own practice, he started to give women progesterone at week 8, or maybe even before that and leading up to week 8, just to make sure that their body was producing enough. And after doing that, he started to have next to no miscarriages happening at his clinic. He's literally saving lives, you guys, by just giving progesterone through week 8. He is saving these babies' lives, and he's saving these mothers' hearts. And something else that I'm like kind of bouncing all over here, but there was something else too, where the United States does not consider miscarriage as a cause of death. And I think that's just because in our culture, we may not see these little babies as babies. We may not see them as humans, but we do know that conception is the moment where a brand new human life is conceived. It can't be anything else. There is nothing else that it can be. And so we know that there's a brand new human life there. So with miscarriage, that means that there is a human life that is dying. But the United States does not consider that a cause of death. If they were to consider that a cause of death, that would mean that miscarriage would be the third most cause of death, just behind heart disease and cancer. This is how prevalent that is, and how sometimes easy the fix can be. Now, again, I am not at all saying that the fix is always easy. And I'm also not at all saying that if you've experienced a miscarriage, you did nothing wrong. There is nothing that you did wrong. But with this new information that we have, that through this podcast, I'm trying to educate people about, and through people that are much smarter than me, trying to educate other people about, we can better our medicine. We can better our care of women, especially women that are experiencing these recurrent miscarriages, and maybe just give them some progesterone and see if that can do anything. And also not waiting until the second or third miscarriage, but just being proactive, giving progesterone even before the miscarriage happens, right? So infertility, miscarriage, those were two big things that were covered. Now, the third one, if you can hear me kind of flipping my paper because I was taking so many notes. But the third one, and this is more of a short one, but is about endometriosis. Endometriosis is a very, we know that it is a huge cause of infertility. And endometriosis, for a very, very layman's terms, understanding definition of what that is, it is basically where endometrial tissue. So when you have your period is the bleeding that you see is what's called the endometrium. It was the uterine lining that's being shed. And so every single cycle, you have this uterine lining that thickens on the inside of your uterus. And then when you're not pregnant, your body recognizes that and allows that uterine lining to shed. And so that tissue, the blood cells, the blood vessels that are the endometrium, that are that uterine lining, it should be growing on the inside. But when a woman has endometriosis, that means that endometrial tissue is growing somewhere on the outside of the uterus. So somewhere where it shouldn't, right? Because endometrial tissue should remain on the inside of the uterus. So sometimes it can be on top of the uterus. Sometimes women will have endometrial tissue on her ovaries. It can be anywhere. It takes an average of 10 years for a woman to be properly diagnosed with endometriosis in the current state of medicine that we are in. That's insane. And the reason why is because what is one of the main symptoms that a woman experiences when she has endometriosis? Painful periods. But what is one of the main lines of treatment that a woman is given when she goes to the doctor and says, I have painful periods? She gets put on the pill. Now, there is argument out there that I have heard that doctors will put a patient on the pill even if they think that she has endometriosis because it can quote unquote stop the growth of endometriosis. There's a few issues with that. So the first one is that that's actually not quite true. When a woman goes on the pill, that endometriosis, it might slow the growth, but very, very often it's just allowing more time for the endometriosis to grow and to get worse and to get way, way worse than where she was, where her endometriosis was at when she first presented herself to the doctor with painful periods. So it does not just halt the growth. Now, even if that were to be the case, though, that it just halts the growth, that means it's still there. And that means that the endometriosis itself is not being treated. It's not being addressed. It's just, it doesn't really shrink. It either stays there or it continues to grow. So the pill is not fixing it. It's not healing it. All it's doing is maybe slowing it down, but even if it doesn't, it's just giving the woman more time for it to get worse and for it to still be there. Like, it doesn't take it away. So the only proper way to truly diagnose and treat somebody with endometriosis is to actually do surgery. So there is a diagnostic surgery that needs to be done in order to actually diagnose someone fully with endometriosis. You might hear some people say that it can be seen on an ultrasound. It really can't. I actually have a patient who was told by a doctor, not at my clinic, that she had endometriosis because it was seen on her ultrasound. They went in surgery to remove the endometriosis, and turns out there was none there. So she had this surgery for nothing. So it's really important that endometriosis is properly diagnosed with a diagnostic surgery. And then if there is some there, then you're treating it right then and there. But another sign of endometriosis besides painful periods is 2 to 3 days of premenstrual spotting. So if you are starting off your period by having 2 or 3 days of spotting before that first full like bright red blood flow, that can actually be a sign of possible endometriosis. But not too many doctors are asking that question and knowing what to do with the answer. And so, yeah, again, all of this information, it deserves to be in your brain. You deserve to know this information because it can save you years of struggling with painful periods, of struggling with infertility or whatever you're struggling with. This information given to you and given to doctors can save women years of heartbreak and years of pain and years of whatever unwanted symptom they are experiencing, right? And so I really don't think that the pill, I feel like I can make a really good argument that the pill is not a great first line of treatment for endometriosis or anything for that matter. I have a whole other podcast on PCOS and my whole story with being put on the pill and having this PCOS diagnosis, all the things. And so, it's never a good option because it's not actually healing the issue. It's just masking it. It could actually help the symptoms, but it's not actually treating the root of what is causing those symptoms. And it could actually just be delaying a diagnosis, which is actually what happened to me. I did not have my PCOS diagnosis until I was off the pill, started charting my cycle, actually went through proper blood work, ultrasound, all the things to be properly diagnosed, and then actually work on treatment from there. So that's the whole thing with endometriosis. I just thought was very fascinating. And then the last one, number 4, is just the pill. Let's just talk about the pill. This whole podcast is me talking about the pill and giving you the information about the pill that you don't know yet and that you deserve to know. And so something really fascinating about the pill, and I'll just give this one little fact about it because I talk so much more in other episodes that you're absolutely welcome to go listen to about the pill to educate yourself more. But there was something that I learned that really just blew my mind. And that is that the pill, and when I say pill, I really just mean any hormonal contraception. So Depo-Provera shot, Nexplanon implant, Mirena IUD, all of these different forms of hormonal contraception. It ages your cervix 2 years for every year that a woman is on it. Okay, so what does that mean? That means that let's say a woman gets on the pill, or a young girl gets on the pill when she's like 15. That's a really common age for a girl to get on the pill. And she's on it for 10 years. That means that when she decides to get off the pill when she's 25 years old, and 25 is like prime fertility, right? That is the age of prime fertility. When she's 25, she gets off the pill, her cervix will be 35 years old. So the 10 years that she was on the pill, her cervix aged 20 years. And what does this mean? Like, why is this so important? Well, talking about cervical mucus, I already mentioned earlier how important cervical mucus is for your fertility. This means that if we are aging your cervix twice the amount of time that it should be aging, that means that your body's ability to produce that cervical mucus, which comes from your cervix, becomes less and less. And so you've heard of women who get off the pill after being on it for a really long time and they're struggling with fertility, or they're struggling with infertility. They're struggling to be able to get pregnant. Well, that could be one of the reasons, is that because cervical mucus is so important. It is vital to produce a good quality cervical mucus to keep the sperm from your husband alive long enough to be able to reach the egg that you are ovulating, cervical mucus is vital to be there. And so if your cervix has been aging faster than the rest of your body, that can pose a real problem. So with these 4 things, infertility, miscarriage, endometriosis, the pill, these are just 4 big topics that were talked about a lot during my training. And I just wrote down these facts and I'm like, oh my gosh, like people need to know this information. Why is this not talked about? So, I mean, that is the purpose of me doing this podcast, is I want to make this something talked about. I want you to become more empowered and more just understanding and educated about these things, about your fertility, about mainstream medicine and how there might be a better option. And so I'm so grateful that I got to go to this training and to be a speaker for, again, it's Facts About Fertility. I think it's .org, but you could also Google it and find it pretty easily. I'll put the link in the show notes below. But I just found all of this information so fascinating and just such an injustice that we don't know it. So I hope that this podcast was educational for you and really just helped you become more pumped about getting this information out there, teaching other women in your circle about this, teaching your doctor about this. I actually very much recommend, if you are seeing a doctor, or OBGYN especially, that isn't trained in knowing about fertility awareness-based methods for the sake of medicine, give them some resources to learn. Even if they don't necessarily want to go all out in learning this and becoming trained in it, it's still going to be really important that they are at least exposed to this other option. And then hopefully they do their own research from there. But you can always direct them to Facts About Fertility, and that is actually a really good resource for doctors. That is an organization meant to teach doctors and med students about this information. So I hope you enjoyed this podcast and learned a whole lot. And please share it with a friend. That really helps me to be able to continue to give you this content. I'm really enjoying this, and I hope you are too. So thank you so much for sticking around, and I will talk to you again next week. Thank you for listening to the Truth and Fertility podcast. If you are enjoying this content, it would be amazing if you could leave a 5-star review. That helps me tremendously to be able to continue to produce these episodes for you. Remember that these podcasts are available on Apple, Spotify, and Amazon, and YouTube. And you can always go to my website, truthandfertility.com, to learn more. Thanks again for listening, and I'll talk to you again next week.